As new injectors, when we first start injecting, we learn the classic three areas for tox: glabella, frontalis, and the crow's feet, and we get comfortable there. But then we quickly realize that we're neglecting the lower face, and the lower face takes quite the beating when it comes to aging changes. So, neglecting the lower face gives your patients or you a disconnected appearance where you have this smooth upper face, but then the lower face continues to age. One muscle that's completely overlooked is called the Depressor Anguli Oris, or DAO. I'm going to walk you through my exact technique, how I evaluate a patient that would be a great candidate for this, and how I perform my actual technique. The DAO is this triangular muscle that originates at the mandible and inserts into the modiolus, which is this fibromuscular junction at the corner of the mouth. And its function is to pull down the corners of the mouth. So over time, with repeated expression and aging changes, we get this cumulative downward pull in our smile, often making us look sad or upset, or even like we have an RBF. I have patients come in all the time saying that they look like a sad bulldog, and I'm starting to experience it myself. I'm starting to notice that downturn in my oral commissure as well. It's just a part of aging. We're losing fat pads. Our fat pads are descending and deflating over time. We're losing bone. We're losing the integrity of our skin by losing collagen, elastin. So many things are working against us that are all contributing to this perioral aging appearance. We start to experience marionette lines, which are the folds that are from the corner of the mouth down the lateral chin. And it's these folds where we're experiencing the jowling. Our mentalis starts to, or our chin starts to experience that orange peel effect, and it looks almost like it's cobblestoning. All of this is changing. So by injecting the DAO, I also love injecting the DAO with the mentalis and kind of cleaning up that lower face in the perioral region. I think it looks absolutely beautiful. How I determine if a patient is a candidate is by having them frown. When they frown, I have them frown and I see, are they pulling down on that from that DAO? If they're not able to make a strong frown, then I don't think that they're going to get a strong uptick in their oral commissure. Some patients can't pull down on that DAO. You have to really connect your mind to that muscle to pull it down, and you'll often see that they can't even make that face. So when I inject the DAO, I really want to see the outline of that DAO, and I'll also have them pucker and see if they have that orange peel effect to their mentalis. So by injecting the DAO in the mentalis, it really cleans up that entire chin area. So how do we inject the DAO? I will humbly and transparently say that the DAO freaked me out for years. I was terrified of hitting that DLI, or Depressor Labii Inferioris. It terrified me. It's a complication that we experience because that DAO overlaps with that DLI, Depressor Labii Inferioris. That DLI muscle pulls down the pulls down the lower lip. So if you have any bleeding of tox into that DLI, or you target it specifically, your patient or you are not going to be able to smile. So when you smile, it's going to look like this. And your upper lip is going to stay up and it's going to be like this because you can't use that DLI to pull it down. So I will humbly say that this scared me enough, and although it's an aesthetic complication and it'll go away, it'll fade once the tox fades, it's not permanent and you're not hurting the patient. But as an injector, we want our patients to have the most beautiful results ever, right? That's our goal. That's how what our business is built off of. So having the potential of having this aesthetic complication, it paralyzed me from even wanting to perform a DAO injection. So once I mastered it, I really became so obsessed with the results of this treatment, and I'm so upset that I spent years avoiding it because it can really, really, really impact the appearance of the perioral region for a patient. So how do I inject the DAO? I have the patient frown. Now, the DAO in different areas is more superficial or more deep. As you get closer to the oral commissure, it's more superficial, lying just below the dermis. So your injection depth is going to vary based on where you're injecting the muscle. Some providers like to inject it in one point at one point, and others like to inject 2 points of the muscle. For me, I like to get the insertion and the origin. And the way I do this is, and everybody's recipe is a little different. You can skin a cat 100 ways, in my opinion. As long as your patient gets a beautiful result and you avoid hitting the DLI, who cares, right? So the way I inject the DAO, I have my patient frown. And when I'm injecting the upper portion of the DAO closer to the oral commissure, my injection depth is superficial. I want to get just below the dermis where that muscle is. As I go lower towards the mandible, I'm a little deeper because it originates on bone. It originates at the mandible. So I can go a little deeper. Now, how do I avoid hitting the DLI? Well, first, let me tell you my units. I typically do 5 units per DAO. So I draw up a 10 unit syringe and I'll do 2.5 per injection poke. And the way I do it is I have them frown. I have them go, and you could see where my DAO is pulling down. Where you see that little pucker in the DAO, that's where I'm going to go superficially with 2.5 units. Right there. Let me get close. Right there. Where that pucker is, I'm going to go nice and superficial. Then I will create a diagonal, and typically you can see the outline of the DAO. You'll take a line, go from the oral commissure all the way down that DAO. I don't do a vertical line. I'm diagonal from the oral commissure all the way down, and then I will inject deep 2.5 units right here to get the origin of that muscle. So superficial, deep. And you can see where that muscle connects on that mandible. When you sit at the lateral border of the DAO, I have never hit a DLI. I'm not saying it won't happen to me. I'm saying with this recipe, it's kind of kept me safe because I'm not injecting on the medial border of that DAO where that DLI is going to overlap. I sit on the lateral part of the DAO and superficial and then deep. 2.5, 2.5, and then I repeat the other side, 2.5, 2.5. So I hope if you're an injector and you're terrified like I was when I first started out, that this encourages you to give it a shot. Maybe try it on some family or some friends that you know you won't disappoint if you, God forbid, hit that DLI. But start working on your patient's lower face. Include the mentalis, include the Nefertiti, include the platysmal bands. All of this will cohesively come together and it'll start to match that upper face beautiful tox treatment that you're offering your patient. So don't neglect the lower face like I did for years. Jump in. If you have any questions, comment below. And if you're loving these videos, please subscribe to my channel. I'm trying to get to 1,000 subscribers by the end of the year, and your subscribing will help me reach that.